Good evening again, everyone. Good morning, good afternoon, depending on what part of the world you're joining in from. My name is Deborah Omage. I am the Program Associate for Nigerian Mental Health. We are happy to have you here. Please feel free to introduce yourself and tell us where you're joining in from in the chat box. And just, connect with other people. I mean, this is a network, we love to share the love around ourselves and amongst ourselves. So please feel free to do that. Today, I'm happy to welcome you to the official launch of Nigeria's first mental health policy commitment tracker. I hope you're excited just the way I am. I mean, I've been talking about this for the past 1 month. It's been an amazing time. It's been a long time coming, and I hope you're truly excited. So please, I'd love to see your excitement. Put some emojis, some claps, some love. Show some love. I mean, it's been a long time coming, as I said before now. We're happy to have you here. A special welcome to every single one of us. Also to our speakers. I mean, some amazing people are joining us today. What a pleasure and an honor to hear from every single one of them. Um, Before we get started, as I've stated earlier, please feel free to continue ensuring that you invite people to be a part of this conversation. Some of you might have heard about Nigerian mental health before now, one way or the other. As for some of you, the first time you've heard about us is just through the invitation for this event. So I'm going to introduce to us again Nigerian mental health and tell us a little bit about what we do, some more before we get right into the conversation. Nigerian Mental Health is the country's largest multidisciplinary network of mental health professionals. We're basically a network of over 50 plus organizations working to improve the landscape for Nigerians in Nigeria and the diaspora. Our work focuses on policy advocacy, on research, on disability inclusion, on wellness, and some other beautiful things, including community support. Um, We've been established since the year 2019 by our able founder, Chimia Sonia, who is also on this call. He's this real celebrity amongst all of us, to be honest. So please show him some love again as well. The reason why we're here today, as I've stated earlier, is to launch Nigeria's first mental health policy commitment tracker. And we have some key objectives for this conversation today. Over and again, people asked us since we shared this, oh, why are you doing this? What is truly the reason behind doing this? And we've said is to ensure we have an accountability infrastructure. And so, in line with that, as I've stated earlier, that is the main and the major reason we are doing this today to ensure that promises that are made by key stakeholders, including the government, don't just remain in fragmented speeches, but able to see everything in one key space, in one environment where we can say, yes, this was said so and so date, and this was the other thing said in all of the communiques and the likes. Also to ensure transparency. Sometimes people make promises in relation to mental health, but we don't know where they are. We can't see them anywhere because, again, we do not have a central environment for it, which is part of the reasons we put that together. So these are really some of the objectives. Again, public engagements, as we've said, it's not just so we can have this and hoard it somewhere. It's for you, the public, so you can ensure that your leaders remain accountable. You can hold them by the hand and by the neck, if I may say, and say you have promised this, and so ensure that you keep to your words. And finally, of course, for institutional memory, again, some of these things get lost, right? We don't know where they are. So that is a major reason and objective why we put this together and why we are here to ensure that the public knows the tools and the power that is now in their hands. Ade, can you go on to the next slide, please? Great. So a bit about what we'll be going through today. Of course, we would start with, opening remarks from our able founder, and then we'll get into the keynote speech from Ms. Vivian. Of course, we'd have a live demo of the policy commitment tracker. That's a specific part that I'm truly excited about, as well as the panel session. I have a favorite there, and I hope we get to, I hope I'm not biased too much when we get to that point. We have a live Q&A session that would happen towards the end where we basically listen to all of your questions and give you as many responses as possible. And of course, we'll close with closing remarks again from our able founder, Chime Asonye. Some housekeeping rules before we get right into the conversation. Please ensure that your microphones remain muted to ensure that we are not disrupted or distracted while we have this conversation. Of course, when you have questions, if you have any questions, feel free to type them in the chat box. And then when we get to the part of questions and answers, we will take your questions and respond to them. Please, I'd like you to note that this session is being recorded, so we could publicize it more. We can always also go back to this conversation whenever necessary and just, reminisce on the beautiful things that would be shared in this conversation. And again, please feel free to invite your colleagues, your friends, every single person that you know to be a part of this historic moment. I keep mentioning how it's a historic moment. Believe you me, this is the first of its kind in Nigeria. So now we're about to have Chime Asonye, our able founder of Nigerian Mental Health. Chime Asonye is a leading public policy advisor and a mental health advocate. He previously drove the UN Sustainable Development Goals in Nigeria at both the federal and state level. He is a Northwestern Law alumnus. His thought leadership has been featured in the World Economic Forum, CNBC Africa, and Harvard Africa Policy Review. Please give a round of applause for Chime Asonye while we hear from him. It's always an honor to hear him speak. A round of applause, a round of applause, a round of applause. Chime, please, let's have you.
Okay, thank you. Can you guys hear me? If you can hear me, can you clap or can you say something in the chat so I know that I am being heard? Okay, I'm seeing some claps and I'm seeing my face very big. So it looks like you are hearing me. Thank you so much, everybody, for being here. My name is Chime Asonye. I'm the founder of Nigerian Mental Health. When Nigerian Mental Health started, we started with about 5 people and we've grown from 2019 to over 50 plus organizations. And this is a big day for us as an organization, but I think for the community of mental health providers, because it really is a testimony of how far we've come, where we're not just asking a question around actions, we're asking the questions around accountability. So I want to take us back a little bit. In the prior administration, the past president are all known for different things. I would say, like, Goodluck Jonathan, one of the things he's now known for is ushering democracy. We had one of the freest election when he helped inaugurate a new electoral commission. And one of the things that is the legacy, in my opinion, of the last administration is around disability inclusion and mental health. Buhari signed the National Prohibition Against Persons with Disabilities, created things like the National Commission on Persons on Disabilities. And during that same administration, we had unparalleled reforms in a social sector, and that social sector is in mental health. I would dare say that the biggest social reforms that happened in Nigeria happened in the mental health space. We had a new Mental Health Act passed. The first is independence. For people who are watching the video, something that has never happened before. We had 2 national mental health strategies. We had a mental health policy that was updated after 10 years of dormancy. The mental health policy from 2013 to 2023, it was updated. And we had the country's first ever suicide prevention framework that was signed. Nigeria is only one of less than 10 countries that had it. And during that time, something emerged, which is, how do you turn these legislative achievements and these policies into action? And so when we're discussing things we started discussing things that we really haven't discussed for as a country. We started talking about a roadmap for a mental health act. We started talking about monitoring and evaluation systems for these policies that would talk about reporting and things like that. So we were guided in a sense of, how do we turn these things from paper into practice? And people and larger awareness start to occur about mental health in the country. And so we want to credit the past administration, we want to credit the Federal Ministry of Health for leading these bold reforms and bringing civil society into these conversations. And civil society and from all range, from psychiatrists, psychologists, to those with lived experience, to human rights activists, for making sure that they mainstream themselves into the conversation. And that action has led to a lot of different things that have going on so far. For instance, just the other day, we had a person that's based in America who reached out to Nigerian mental health, and his mother is having different issues around psychosis and dementia. He doesn't know where to go to. And he reached out to our organization to see if we could put him in touch with an individual that will support his efforts. These are the type of real world stories in terms of this global work and awareness that are actually leading individuals to reach out to us directly to promote their events, to support advocacy, to do support things around direct services. And so we have collaborated with different partners across the world to make a difference in people's lives. And that impact is shown in different ways. As you can see on the screen, you can see some of the efforts that we've had to drive systemic reform around championing with a coalition of other partners, over 40 plus, work to get the Mental Health Act passed. Around our behavioral health agenda, one of the things that you go, if you see in our website, is we have a 10-point strategy that we did in common in a partnership with the National Human Rights Commission and National Person on Disabilities, where we map out 10 areas based on the curated ideas of civil society of how we think we can improve the mental health sector. Things like nothing about us before us, things like funding. We also are working right now on a suicide not crime campaign. We're leading over 40 plus organizations to help get that. We have a signature of almost 10,000 individuals, and we helped draft a law that's currently in the National Assembly to decriminalize attempted suicide and elevate a public health approach. We know that if somebody's suffering or in crisis, what they need is support. They don't need jail. That only increases their challenges. And in a study, as you saw in the video that played in the beginning, this really impacts women. In places where suicide is criminalized, when there was a global study done, there is an increased number of women death by suicide. So there's a gendered violence impact to the fact that we have suicide currently criminalized in our criminal and penal code. And more recently, we helped launch the National Resource Directly and helplines. If you have help or you need assistance, you can go to our website. We've curated crisis hotlines, but more important than that, people ask not just for hotlines, but where are physical locations where they can get support. And so we've curated different helplines and resources that individuals can go to if they need support that are across the nation. These are the type of efforts that cause system change. And so we worked on these things, but what we wanted to do is not just ask ourselves, what is going on now with one particular policy or one particular law? We've seen that. We need to turn these laws into action in real material ways. And this is not ethereal. For instance, we've had commitments from government that there was going to be suicide decriminalization in December. We're now 6 months later in June. That promise has not materialized. We've had a Mental Health Act that transformed the country in different ways to try to mainstream it into the grassroots and into primary healthcare centers, to do things like stopping chaining, to do things like creating a mental health fund. Some of those things have not materialized. We have other promises to create things like a surveillance system, because we need to make sure we mainstream mental health within larger, broader surveillance. And so we can't keep on asking the questions of what's going on with a suicide prevention policy, what's going on with Mental Health Act. We need to ask ourselves a larger question is, are we asking the right questions and are we holding these things accountable? And so the goal of this session today is to create a centralized system where we share these commitments from different levels and we make sure that we can track them. Some people do not know a lot of these initiatives or policies exist. Not only do they not know that these initiatives and policy exist, there's ones we're not aware of, which is why we did something very unique. We actually, last month was Mental Health Month. And for Mental Health Month, we launched this formally. And we told the public tell us what the commitments you are, not only what your reaction to this data tracking platform is, but maybe your local government member, maybe your church has made commitments and promise. Maybe your state government has made commitments. We want to hear that because we want to add that, which means that this is a living document. People can go, they can give us feedback, we can update it because we want to make this fit for purpose for the public. We want to stop asking questions about the actions that are notable for government, are revolutionary, where we're leading in Africa, and start asking the questions of accountability. Where are we with these things? And let the public know the different angles. So if you believe in this struggle, if you believe in wellness, if you think that wellness is one of the most important challenges in a country like ours, where we have a lot of issues and challenges from unemployment to joblessness to conflict, we need to support our wellness. We need to come together as a community and we need to ask the right questions. This mental health policy commitment tracker is a step towards that direction. And we want you to join us in this particular endeavor. You can go and follow us on our social media handles that I think are going to be showed next and hopefully shared in the chat. And if you do, you can do things like join us by signing our petition. You can join us by sharing our story because you don't know who may need it. Just like the young man contacted us about his mom to see if we can get him support in Nigeria, we want to provide a vehicle, a lens, and a roadmap where we can provide support for all Nigerians when it comes to mental health. I'm excited for you to be here today. I'm excited for you to be part of the conversation. We have an amazing panel to help unpack why this conversation is important. And so let's get this conversation started. And please continue to check in with us.
Okay, thank you so much, Shimi. It was amazing to hear from you. Guys, please let's, give some emojis. I mean, I say it over and again how it's such a refreshing time to listen to Chime talk. I'm sure that, we've been able to pick one or two amazing things from what he said. What he said, as I've said, or as he said earlier, really a lot of links have been shared in the chat box for you to see some of the amazing things that we have done. So please feel free to check them even after this conversation. Next would be going to the point where we listen to our amazing keynote speaker. Ade, I can't see your slides anymore. Can you check what's happening there? Okay. All right, so as I said earlier, next we have our amazing keynote speaker here, Miss Vivian, coming to speak to us, where she would, be telling us a bit of what we need to hear in this moment, at this point in time, basically the keywords we need to know. And please give a round of applause for Miss Vivian Ikpeazu. Miss Vivian is the managing, Mrs. Vivian, please, I apologize. Mrs. Vivian is the managing director of Nigerian Health Watch, a Chatham House African Public Health Leader Fellow. She leads high impact communications and advocacy strategies to improve health outcomes, strengthen health systems, and expand healthcare access across Nigeria. Her work focuses deeply on health equity, particularly addressing persistent inequities affecting women and underserved population. Please give a round of applause for Mrs. Vivian as we come listen to some wise words from her. Thank you, Ms. Vivian. Please feel free to, turn on your camera and would spotlight you. Amazing. Give her a round of
Hello.
applause. You guys not excited?
Thank you very much. Can you see me? Can you hear me? If you do, just thumbs up. Oh, what a wonderful privilege and pleasure it is to be here today, and just wonderful to see so many people who have joined this event today. It's really good to have all of you here virtually. I'm sure there'll be opportunities in the future to have such events virtually, some in person. So thank you so much to Nigerian Mental Health for inviting me to give this keynote address. I think listening to Chime, the passion in which you speak clearly shows the energy and the commitment that you and your team showed to this very important issue of mental health. So as was introduced, I run an organization called Nigeria Health Watch, and it's a non-profit organization based in Nigeria. And, this event is very personal to us as well. Over the years, we have really focused and channeled a lot of our time and energy to the issue of mental health. So, as a health communication advocacy organization, we have always looked to drive evidence-based advocacy, strengthening health sector institutions and really influencing policy for impact. So that's why this tracker, we were really excited to hear about it, because using all the data and using all the evidence, how can we ensure accountability? So as an organization, we feel it's really important to make sure that Nigerians are well informed, are empowered to have all the information and data to keep and ensure that they are empowered to make informed decisions about their health. And, we aim more than anything through our mission to make sure the communities, organizations, governments have the tools and knowledge that they need to make those decisions. So this tracker that you're launching today really, I think, positions people to be better informed about mental health. And also, as we said, we aim to hold government accountable and make sure that the policies that government promises they will implement actually do. So as an organization, we have a track record of advocacy campaigns that we've done over, the past few years in our, an organization's history. So, for example, we led a campaign that looked at maternal health. So the Giving Birth in Nigeria campaign, which brought together stakeholders in maternal health to find solutions for better service delivery. The U=U campaign, which encouraged better adherence to HIV treatment as a proven way to suppress people's viral load. A project we're currently doing, the Global Policy Advocacy Project, really drives for systemic change, connecting evidence to policymakers, amplifying community voices more importantly. And I mention all of these examples because really, as an organization, it's always been our mandate more than ever to ensure that, the health landscape in Nigeria is fully optimized to support the healthcare needs of Nigerians and really push for policy commitments. So I think as an organization, Nigerian Mental Health, you are very much in tune with that, in making sure that Nigerians are able to have access to better mental health care. And Chime went through the history that we've gone through, so I won't go into detail. But just to think about it, in 1916, we had the Lunacy Ordinancy Act, which was a long time ago. Of course, many of us were not alive then. So it was now revised into the Lunacy Act of 1958. And there were so many shortfalls in that act. How people were stigmatized, how suicide was stigmatized. And up to today, many believe that suicide is still a sin. So that is why we need some of these acts that really offer better protection, offer people dignity, offer quality care. And as time has gone on, a lot of these shortfalls were very quickly addressed. So it was really great. And I think Chima mentioned that it was in 2021 when 2023, when President Buhari finally signed the Mental Health Act. So all of these acts, as we've seen, the country has really been on a journey. And with every outdated act, it has introduced as much as possible a much more comprehensive framework that has ensured that mental health promotion, treatment, rehabilitation, protection of human rights more than anything, anti-discrimination measures are ensuring that ordinary people who may be going through challenges have access to the care and the protection that every person has a right to, with all the full dignity that they deserve. So, there has been a significant shift on how mental health is governed in Nigeria, and I think there's a lot to be glad about how this, in the last 5 or so years, it has really changed. And in that, at all levels, the aim has been to prioritize mental health services and resources, and to build a much stronger community-based structure. And more than anything, as I said, how are we making sure that we're upholding the rights of everybody that needs the mental health support, however and whenever they want? So, it's important to go back, and it's also important that we look forward. So, as the adage goes, you cannot know where you are going until you know where you have been. So we know the history and we know where we started from and we know where we are now. So we're thankful that this is where we are now, and really also better that now these conversations about mental health are growing. More Nigerians are speaking openly and honestly about mental health, because even thinking, within our normal social circles, etc., within our families, the minute you mention mental health, there is almost a vision of a person who the vision of when we say mental health, we think of people who you may sometimes we see people who are homeless on the street, and we assume that is what mental health looks like. So if somebody has mental illness, there's something significantly wrong with them. Until you really start to break it down, that when we say mental health, it's something that every single person on this planet experiences at some point. It is depression, it is anxiety, it is grief, it is burnout. All of these are all elements of mental health, and why every single person, whoever you are, public, private, has to understand the importance of having these strong laws, regulations to protect everybody. So we now see many public figures, young people especially, communities who once may have stayed silent, are now finding their voice, finding the language, the vocabulary, and the courage to speak up. A recent example, a friend of ours, and many of you probably know who this is, Chut Jidomo, he wrote a book about mental health. He wrote about how, the book is called How Depression Saved My Life. And in it, he shares his personal experience of depression. So when you see someone like Jude, you would assume, everything's happy, everything's going on. But as we say, mental health doesn't have a face. It could be everybody, and it is everybody. So his book really talked about his experience. And this is an example of how people are more open, are talking about mental health. And I think in doing so, it really helps take away a lot of the stigma that we've always seen historically. But we've also seen how digital platforms, how social media has played a huge role in shifting the way people see mental health. It has given people the space to share their experiences, to push back against a lot of the stigma. And it has also, for a long time, ensured that the access people may have not had before to information, in a way, those platforms are filling that gap. So we also have seen how cultural and social barriers still exist, but very slowly, attitudes are changing. And when those changes come, it demands that our health system and our policies and our institutions respond with the same seriousness and resources that mental health has always deserved. So really, it's in this context, I know that, your organization, Nigerian Mental Health, developed the National Mental Health Policy Commitment Tracker. And, looking through this tool, I saw how, it's a very important tool in how it was intentionally designed to make sure that we boost stakeholder accountability on mental health laws, policies, financing, because policies often, as in our experience as an organization, can sit on the shelf, but without the financing and the commitments, implementation can be hard. So it's really great to see how the tracker is beginning to bring together some of the many commitments that the federal and state governments have made, public institutions and development partners, and making sure it's in one publicly accessible system so anybody and everybody can see what has been promised, who to hold accountable and responsible for delivering what, and also tracking what progress and how much progress has been made. So we really look forward to seeing how this tracker will really improve and improve the transparency on some of the commitments that have been made. And also talking about using data, the data that the tracker is used, which we're really great to see, is from a wide range of sources. So clearly it is a really great tool that draws together information that anybody may need and can use as and when they require it. But as we know, in our country, it's not enough to just have policies because we have so many policies. I'm sure many of you will agree. But policies do not go anywhere on their own. We have many policies in Nigeria, but the challenge we continue to have in many of those policies are not implemented. And people often also are not aware of what these policies are. So this is, I think, a really great gap that this tracker will fill. So our role is really to make sure that these policies and commitments are translated into trackable and measurable improvements in people's lives and ensure that mental health services provide people with the safeguards they need. So for us as an organization, as I mentioned, we have done advocacy across a broad spectrum of issues. This mental health tracker is another great initiative, and it would ensure that all people concerned, be it NGOs, CSOs, are really pushing for that policy accountability so that the commitments that have been made actually lead to improvements in mental health care in our country. So finally, mental health is not a surface issue. It really sits at the heart of a functioning and very productive, humane society. And every commitment that goes untracked is a promise that risks being forgotten, and every policy that goes unimplemented is a person who goes without the requisite care that they need. So the mental health policy commitment tracker, we feel, is going to be a great contribution to ensuring that this doesn't happen, and what is promised is pursued, and what is pursued is measured and delivered. So we believe that, with accountability, it is a great way to make sure that these policies get implemented. And as we remain committed to that advocacy, we will ensure that we stay on this issue for as long as is required and as long as is needed. So it's been a pleasure. Thank you so much for inviting me to give this keynote address. And it's really great to be part of this very important conversation this evening. And we look forward to working alongside partners who are advocates and people who believe that it is possible to get a better mental health framework and landscape in Nigeria, where people who need the care and support receive it as and when they need. Thank you very much.
Thank you so much, Mrs. Vivian, for sharing that amazing keynote. Everyone, please let's give her a round of applause. I mean, I was here jumping for joy inside of me listening to you talk. And, over and again, it kept ringing in my head how mental health is any of us and it's all of us at the same time. It has been an amazing pleasure listening to you. And definitely, we would hold you to your words in terms of, ensuring that this tracker keeps on pushing over and again as much as possible. We are going right to the next segment. So shortly, we'll be listening to Ade, who is a member of our team, take us through the tracker. Mrs. Vivian had just mentioned some of the amazing things that she said that she saw in the tracker, and I couldn't help but, raise my shoulders up a little bit. So Ade will be taking us through that a bit shortly. But before that, I want to give us a bit of context into I'm just realizing that I'm back in the live now. Don't worry, in a few minutes I would adjust that again. But just bear with me shortly. You'd see my pretty face again soon. But yes, I'll give us a bit of context as to why, we did the tracker. I know Chimi has done that. I would just basically highlight some of the things that has pushed us to doing this. Over and again, people had asked us why this, at least in the last month. If for every time I was asked that question, I'm sure that I would be a millionaire in dollars by now. Why a policy commitment tracker? And basically, it's just because we've heard so much about awareness. We've seen it a million times, we've heard it a million times, and we're tired of the language of awareness. Awareness is important. We still need to do more things around awareness, but it's now beyond awareness. Okay, sometimes promises are made, and we're like, yes, we're waiting for this day so we can celebrate as a nation, but it falls through. Again, missing infrastructure is what you see on your screen. And really, I don't want to go too much into it because it's been said over and again. Some of the things that we are measuring through this tracker, I would say specifically, is one, how we have a severe shortage of mental health professionals. Currently, we have less than 300 psychiatrists attending to over 200 million people in Nigeria. And when you break that down, that is roughly about one psychiatrist attending to over 800,000 people, which is below what the World Health Organization has set as a standard of one ratio, 10,000 people. Also, sadly, with the growing crisis that we have in the country, standing at roughly 1 in 5 Nigerians or 6 Nigerians, that is somewhere around 40 million people. I mean, just imagine that number. You can even try to count. When you count up to 100 with your fingers, you're tired. Talk more of counting 40 million Nigerians living with a mental health condition. And even with that, sadly, about 80 to 90% of our population still do not have access to the care that they need to support their mental health. Talk about finance barriers. Again, sadly, in relation to mental health, so many Nigerians still have to pay out of pockets to get the support that they need for their well-being. And even subnational domestication of the Mental Health Act. Some states have done marvelously well, ensuring that mental health remains a priority at the state level. And for some others, we are sadly yet to hear anything about them or what they're doing in relation to mental health. One, it may be that it's not truly a priority. And secondly, some things may be going on, but we don't just know about it because it is not publicized enough. And again, that's why I'm mentioning the importance and why we decided to put together this tracker and not just put it together, but ensure that we can receive feedback from you, from every one of us, so that we are up to date nationally and subnationally when you talk about mental health in the country. So now I would be introducing Adedeji Adegoroye, who is a member of the Nigeria Mental Health Team. Ade is a cybersecurity and information technology expert. He is a social innovator known for his focus and advocacy on menstrual, mental, and sexual health. Ade enjoys working with and volunteering for social causes, and he has worked with NGOs, social enterprises, and international bodies. He channels his passion into making Nigeria a better country. He's fervently dedicated to advancing mental health awareness for Nigerians, utilizing technology-driven ideas and solutions coupled with his knowledge and passion for business to tackle social challenges related to mental well-being. Through strategic communications and creative initiatives, Ade aims to break down societal stigma and foster a more supportive and understanding environment for mental health. Ade encourages everyone to strive towards a loving and mentally stable future. Please give a round of applause for Ade as he takes us through the live demo of the Mental Health Policy Commitment Tracker. I'd just like to add, Ade is an amazing human. He is someone I root for always, all the time. So please show him some love as much as you can. And Ade, please over to you so you can take us through this tracker.
Thank you, Deborah. Appreciate that. Please, I don't know if you can hear me. If you can hear me, you can also let me know by perhaps sharing or reacting in the comment section or dropping a response as well. Okay. So my name is Adedeji Oluwadare Adegore, and I want you to know that you can call me Ade because I did for you. Going right into it, I'll just say that the platform is a really amazing platform. A lot of work has gone into creating this platform, and the core functions as listed on the slides include a dashboard that shows a real-time policy mapping across the federal and state levels. We also have the commitment pipeline, which also has like a clear tracking of milestones from what was proposed to what was delivered. We also have resource indicators like monitoring budget allocations and universal health coverage. And the major question is, who is it for? It's for journalists, researchers, advocates, and civil society policymakers, and for each and every one of us who want to make sure that we can monitor and actually hold account those who are giving this policies and commitments. You can hold them accountable and see what they're actually doing in a very, very practical way. I'm going to be showing us a dashboard, and we are going to be able to see it. So just let me share my screen so that we can have a look at that. Uno momento. All right. So if you want to access the mental health tracker, you can actually go to our homepage, nigerianmentalhealth.org. And once you land on the page, either you're using a phone or you are using a laptop or a tablet, whatever you're using, on the homepage, you can actually see the first mental health policy commitment tracker. And it's very important to know that that's on the homepage. Now, by the time, please let me know, can you see my screen first of all? Just to confirm.
Yes, we can see it.
All right, beautiful, beautiful. Okay, so basically, when you go to the website, you can actually, at the top where we have the menu bar, if you're on the phone, you have to touch the three sandwich thingy, and that looks like lines, and you'll see policies. And under policies, we have the commitment tracker, the policy commitment tracker. Now, when you click on that, it takes you to a landing page where it explains to you a bit more about the policy tracker. Now, I would like to highlight a very important quote by Mr. Peter Drucker that says, "What gets measured gets managed." Very, very important. So this highlights the importance of what we're doing, because you can only manage something that you can actually measure. Now, we have already explained what the tracker is for and who is for, but I would like to highlight how it works. So when it comes to policies and laws, we're able to track things in a very responsible way, know who actually made the promise, who's responsible for executing it, what has been promised, and the progress that has been made across policies and laws, commitments, and
Hi, Ade. I'm
stakeholders.
sorry to interrupt you, but can you speak up a bit louder so we can hear you clearly? Some of us are struggling to hear you. Thank you.
Apologies. How is this? Is this better?
Amazing.
Beautiful. So I had to turn on the noise cancellation. I had to turn it off because of the video. So for the status guide, we will have to know that every trackable commitment is rigorously evaluated against every available evidence and assigned a clear real-world progress status. We have enforced or fulfilled. So if you go to a tracker, you can see if the particular thing you're looking at, whether it's a commitment, whether it's actually a policy, you can see if it's enforced, if it has been fulfilled, if it's in progress, if it's pending, if it's delayed. And this will help us to track what we're doing. Now, you can also help us track the progress, because on the page, you can see a submit a policy or update correction form, which you can also, because part of what we do is to make sure that whatever information that's been published here is verified and we know who submitted it. And we also know to make sure that it's actually authentic. Now, if you do go down to this, I think I would like us to look at it in the full screen. You can actually see that under policies, we have a list of policies that are currently being tracked or have been added to tracker. I would encourage each and every one of us to actually spend some time. If you have any policy or any commitment that you think should be added here, kindly go through to make sure it's not added already. And if you have updates, if it has been added, you can actually share the updates. If it's not here, you can actually then submit a request for it to be added here. But basically, I'll just give us a quick walkthrough. As we can see, we have each of the policies, we have their titles. For example, we have Abia States one, we have Akwa Ibom States. I think we can look at one of them for an example. So if you look at the National Mental Health Act, which is one of the policies, you can see the type that it is. It's an act, when it was enacted, the coverage, status, and we can even have like a document. We have the source and the evidence to show that, okay, this is actually something that is real, not something that we just imagine on the spot, you know. We also have the year, and we have a short attached summary. which helps you to be able to know what's in the document if you do not have time or the expertise to read through the document and actually digest. This is just for the common man to be able to read through and understand what is exactly in the policy. We also have commitments that are linked to this particular policy. So when we go to the commitment tab, we can actually see those commitments, and we can also still access the ones that are linked to it from here. And we can also add notes, and we also have the stakeholders commitment. So if you click on one of this, you can actually see that these are the commitments. One of the commitments is the Pass the Mental Health Bill. It's a legislation type. And we have the stakeholders, the Federal Ministry of Mental Health, and we also have the National Assembly. We also have linked policies as well, which if you click on, you can actually see it, and it's already been opened, so it's already linked. Now, another thing you can do from here is that you can see where it is covered. That's the state. If it's national, you can see at what level it is. And as like I said, we have the enforce, if it's fulfilled, if it's a proposed draft, etc. And then we also have attachments and the stakeholders as well. Now, when you move over to the commitments page, you also see that we have the commitments, and you can, if you click on one of the commitments, like we did actually see from the policy page, this particular commitment is linked to the national mental health policy that we actually looked at earlier on. And you can see the stakeholders who are involved. So you can click on any of them and you can actually see the linked commitments. But before we jump the gun, I'd like us to also look at you also have notes that they're included in case you need to have anything special. Perhaps you have also added something, we can also include that as notes. Now, when we move to the stakeholders, we have a list of stakeholders. You can see if they are government, multilateral, if they are NGOs, if they are social enterprises. You can also see the level. You can also see their roles or their interests. You can see if they have any other commitments that they are linked to and policies as well. So if we look at the Federal Ministry of Health, we'll be able to see that it's a government type, national level, and we can see all the linked commitments that are linked to their names and notes and policies as well. So if we do click on, you can see that we have the National Mental Health Management Information System, which is one of the commitments that they have committed to. So in summary, this is actually the National Mental Health Policy Commitment Tracker. And before I hand over, I want you to know, as they say, I want you to know that your mental health is important. And I remain Ade, and I dig for you. Thank you. And over to you, Deborah.
Thank you so much, Ade. I see what you did there, and I was about to do the same thing because, like I said when we started, I have a favorite in the panel, but I hope it's not obvious who my favorite would be. But thank you so much, Ade, for that. As we said earlier, you can go on to our website to, just ensure that you familiarize yourself with it. And of course, feel free to give us your input. That's a very important aspect of this, ensuring that, we hear your feedback on it. And now we're getting into the major aspect of this. I'm excited, I'm elated. Getting into the panel discussion, where of course we have my favorite and many others. Again, I'm sorry if you catch or you know who my favorite is, please just let it slide today, okay? Just let it slide today. But basically, we're about to go into one of the most important segments of this conversation today. I hope my face is even visible enough now. I'm sorry, the power supply, it's not great, but I hope you can see me again. Well, we're getting into, Ade, we're going to say something. Am I visible enough?
Yes, you are.
Thank you so much. So we're getting into the panel discussion now, where we'd have an amazing panel with, amazing people doing great and phenomenal things in the space. And I'll be introducing every single one of them to us. So to our panelists, I'm asking kindly that you turn on your cameras while I introduce you, and then we'll get into the conversation shortly. Of course, this is a woman's world, as we all know. So I'm going to start by introducing the females on our panels, and then we'll go into the male panelists to introduce them. First on our list is Benmu Damo. She is the founder of Mental Health and Research Policy Hub. Ben Moon is a global mental health researcher whose work bridges research, policy, and community-based implementation. She is the founder and executive director of the Mental Health Research and Policy Hub, an organization dedicated to advancing evidence-based mental health policy, research, and system strengthening, with a particular focus for conflict-affected and under-resourced community. Ben Moon, we love having you here. It's such an honor to have you here. Please let's give a round of applause for Ben Moon. And now we're getting right into, I'm tempted to sing. Oh, please. Oh, please, I'm tempted to sing. I don't know how to keep this within me. But on our final session now, we have Deja, the amazing, the one and only Deja, known as Hadiza Bell Olo, who is a multi-talented global recording artist, a visual artist, a fashion designer, and a humanitarian. Celebrated for her unique blend of Afropop and neo soul, she uses her global platform to bridge creative expressions with deep social impact. As the CEO of DJ Nation and a trustee for the iChange Foundation, she leads powerful advocacy and humanitarian initiatives across Nigeria while balancing her thriving hyphenate career. Deja, it's such an amazing pleasure and honor to have you here. And truly, I want to sing, maybe towards the end, so that I can remain professional, so that you can know that I'm truly a big and a huge fan of yours. Also, we have Kachi Ofia, who would be joining us also as a panelist. Kachi is a prominent broadcast journalist, TV anchor at Arise News, and a public affairs professional with a strong track record in strategic communications, storytelling, and social impact advocacy across Nigeria development space. Operating at the intersection of national media governance and civic engagement, she is widely recognized for using her broadcasting platforms to translate complex policies, health systems, and mental health issues into accessible television narratives. She consistently leverages her voice on national television to elevate critical conversations on public accountability, stigma reduction, and youth inclusion. Next, we are going to the gents. First here we have Joshua Natus, who is a public health professional and a technology innovator, serving as a senior manager at Lagos Mine, the Lagos State Ministry of Health flagship mental health initiative. He is a certified global mental health expert and an ALX fellow. He specializes in building evidence-based technology-driven systems to transform mental health care. Joshua has pioneered landmark digital and clinical frameworks across Lagos State, including telebehavioral crisis services and integrating mental health into dozens of primary health care centers. Such an honor to have you here, Joshua. And now let's get into government. We have Dr. Tunde Ojo, who is the National Coordinator of the National Mental Health Program at the Federal Ministry of Health and Social Welfare, a dedicated psychiatrist and public health expert. He spearheads Nigeria's strategic efforts to revolutionize mental health care. Please forgive me for that. Infrastructure, drive national policy implementation, and integrate mental health care services into primary health care. His work focuses extensively on reducing stigma, eliminating barriers to care, and advancing health equity across the nation. Thank you all to my panelists for being here. It's such an honor having you. Of course, this panel session will be moderated by my humble self, Deborah Omage. So please, Ade, you can stop sharing your slides so we could have the panelists come on and we can get into the conversation. To every panelist, I kindly ask that you turn on your camera and we're going to spotlight you, and then we get right into the conversation. Amazing, amazing. My fave, oh, I love seeing you. I love looking at you. I'm sorry, everyone. Please forgive me. I'm going to keep doing that as many times as possible. Ben Moon is smiling as well. She sees it, she understands it. So please, everyone, kindly, to my panelists, please let's, yes, spotlight us. Amazing, 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 amazing. Lovely to have you. I didn't even see if everyone was giving you a round of applause. Please, guys, let's give them a round of applause. I mean, aren't you happy seeing them here? Aren't you happy? Of course, of course, of course, of course. Yes, let's go. That's the energy. Amazing, amazing, amazing. So we're getting right into the conversation right now, really. And we have some important things that we want to address during this panel session. But first of all, we have something we would like to hear from all of you. You know, as I stated earlier, for so many years in Nigeria, mental health and the topic, the conversation all in all has been focused on awareness. And today, while we are saying awareness is important, we're also talking about how it's time to move into more structured accountability. So I'd like to ask every panelist here, what should Nigerians stop celebrating and start measuring when it comes to mental health? So we'll just keep this round very shortly, just a minute. And how would go around the room for this one is basically I would nominate Ben Moon to start first, and then you can pass it on to the next panelist, and we just go that way. Thank you.
Okay. Hi, everyone. I don't think I'll say what we should stop celebrating, but I think we should also start measuring community involvement. And I'll pass it on to Joshua.
Okay, thank you very much. For me, just forgive me to mention just one thing. I think we should stop measuring. Stop measuring World Mental Health Day posts because I see that as a measuring stick for so many people. And we should start measuring how many staff within our primary healthcare centers, at least one, is trained to identify mental health crisis. We have over 30,000 primary healthcare centers spread across Nigeria. How many of them just have one staff that can identify mental health crisis? We start measuring that. Thank you.
Hey, Joshua, please feel free to pass it on to another panelist.
Okay, so Dr. Joe.
Well, thank you for having me. I will say what we should start measuring is progress.
Okay, thank you, Dr. Joe.
How far have we gone? Yeah.
Great. DJ, let's have you. What do you think we need to start measuring?
Hello, everyone. Can you hear me?
Yes, we can.
Okay. Thank you for having me. I mean, for us, I would really just say being able to measure real outcomes, you know, the quality of support and the access to care. Those are some of the things that I would, you know, not just talking about the awareness alone, but the real outcomes that we get from people being able to access the care that's available to them.
Amazing. Thank you so much. I think it's really key. Everything that's been measured, talk about community interventions to the primary health care to progress, it's all important. And now we have specific things that, you know, would like to get or hear more about from all of you here in terms of the panel session. You know, all of you do amazing things in your different spaces, in your different fields. And specific to what you do, would like to ask you specific questions. So we know from your perspective, from your space, we can hear what you have to say, not just about the policy commitment tracker, but about mental health and progress that should be made in this space in the country. So I would start with Dr. Tunde Udru. The launch of this tracker changes the relationship, of course, between government and the public by ensuring that the commitments that are made become more visible, measurable, and of course, we can hold you by your throats and by every word that you say. So I'd like to ask you, how should government respond to being tracked in real time? And why is that ultimately beneficial for strengthening the national mental health system as a country?
How should government respond? Well, Yeah. Again, let me start by joining others to congratulate the Nigerian Mental Health for coming up with this initiative. Well, it's welcome. It's a welcome development. Yeah. So how should government respond? Well, government should respond by embracing it. Is a welcome idea, and just like we've said, what is not evaluated or what doesn't get measured, it's not done. And so it's a call on to accountability, and so every government should not only be held accountable, but should be accountable and should be transparent. Yeah, so I think that's what I have to say, but I'm very happy that it's a call to buckle up, and I'm very happy that where we are as a country is because there is something on ground that we want to start holding government accountable for. Maybe, maybe 5, 10 years ago, where we have maybe next to nothing on ground, there won't be anything that we want to hold government accountable for. It's because there's a recent policy, there's quite a lot of transformation in the mental health landscape. And so I agree that the reward for more work, I mean, for good job is more work. And so, yeah, it's putting everybody on its toe. And well, when I had this earlier, I said, oh, come on, what is this all about? But now it's not just about government. Government is at the center of it all, but everyone, mental health is everybody's business, and we have to hold each other as accountable. But I think for anyone you want to hold accountable, government has a social responsibility first to the people. And so the accountability will first stop at the government doorstep. And so we are ready for that. Thank you.
Thank you so much for that, Dr. Joe. And of course, at Nigerian Mental Health, we are very persistent. So best believe that we'll be holding the government through you accountable for quite a number of things moving forward. And so let's go to Joshua now. Interestingly, Lagos State has been at the forefront of doing things subnationally. Lagos State is one of the few states in Nigeria that have domesticated the National Mental Health Act we have in Nigeria. And so I'd like to hear from you through the operational lens of Lagos Mind. What specific pioneering innovations and systemic best practices are you employing to transform this legal framework into real-world care? And what at the core are actionable lessons that other states must take note of to replicate your amazing and phenomenal blueprint at Lagos State?
Thank you so much for this opportunity, and congratulations for launching this landmark event. Um, this is a very interesting question. So Lagos Mind stays or stands as an intersection between law, health system, service delivery, and it was established in 2011, so it's pretty long. And I'll just share three concrete innovations and then one honest lesson for the past years that have been Lagos Mind. So the first innovation was the establishment of a dedicated mental health desk. I think that's the crux of all things. It served as a structural foundation where that coordinates all mental health related issues as concerns the states. And that was one of the huge innovation we had way back as 2011. There was institutional analysis, institutional research that was done with the likes of Professor Delia, and the likes of Dr. Tuba Jumali and the rest of them. So way back as that. The next thing is the integration of mental health into primary healthcare centers. There's a uniqueness with Lagos State. Lagos State currently now has a permanent secretary for health and then a permanent secretary for each district of health. So what we tried doing far back as 2022, there was a research we started doing did to see how we integrate mental health into primary healthcare. We called it a MEPRIC project. And the goal was simply to put mental health at the point of first contact for each person. So, and then we train people, although we had people that We had the jackpot syndrome that happened, but we kept training healthcare workers, community healthcare workers, and the rest of them to identify mental issues. The third thing is to establish the third behavioral mental health service line. So we found out that yes, there is stigma. We can do advocacy, we can do education, we can provide IC materials, we can go to communities, but there is still stigma. There's this cultural barrier that we have that Nigerians or Lagosians have. They're still limiting us to seek help. So what we did was that we then said, okay, since people are not walking into hospitals to seek for mental health service, why don't you provide a dedicated helpline that would serve as a point where people can call in and receive this service, and then have a referral done to general hospitals that are common general hospitals like Bagada General Hospital, Kogi General Hospital. People can walk in and have such mental health services delivered to them. So the telebehavioral line became a very strong point centered around the program we're doing in the ministry. So looking at all this, these are the three concrete innovations that we've done so far. There are other things that we've done, school mental health, investing mental health, several other mental health programs that we've done within the state as a whole. But the actionable lessons that you can take away from this is that the institution of the mental health law is a legal milestone. Yes, fine, everybody can go ahead with that. But I think one thing we need to do after domestication of the mental health law is to establish a mental health desk for each state. I think each state can take this. If you don't have that, if you don't have a focal person that you don't have a named person, a named function, and named people that you can hold accountable for mental health in a particular state, it will just look like a scattered, just look like a scattered work. So that is one of the lessons that I think each state can take from there. Thank you.
Thank you so much, Joshua, for pointing that out. So to every state present here, please remember, and even every organization that is focused on health, remember to have a focal person on mental health. That way you ensure that, mental health is not just an afterthought. It is a part of your ecosystem or well-being ecosystem as a whole. So just a quick reminder, while we still go through the panel session, if you have any questions that you would like us to address towards the end of this conversation, specific to any panelists here on Nigerian mental health as a whole, please feel free to type them in the chat. And then when we get to that session, we'll be sure to address them one after the other. So we'll be moving to Ben Moon now. Ben Moon, it's so amazing to have you here as well. You're my favorite, so inside between us. But today I have another favorite. Let's just keep that out here. So let's talk a bit more about, mental health in the country from your perspective. I think over time we have realized that Nigeria does not suffer from a shortage of recommendations. Ever so often we hear, including ourselves, putting a 10-point agenda. You would hear the international organizations recommending we should do this and we should do that. And interestingly, we take up those recommendations saying that it's something that we'll work towards. And so we realized that we do not suffer from a shortage of recommendations because they come in every other day. What we truly suffer from here is lack or a shortage of implementation. So from your point of view, where exactly does execution break down in our health architectures? And why has holding actors accountable historically been so difficult in our mental health systems here in Nigeria?
Okay, thank you so much for that question. And I think, as we all probably can acknowledge, there's a lot of reasons why execution breaks down. But in the interest of time, I'll just focus on a few. And if you see, I think Dr. Ojo put in the chat about how only about 3 states have implemented or adopted. And as we said, Lagos is one of the states that is really doing good work. But that is one of the main things, is the way that our our healthcare system is tiered. You have your primary healthcare system, your secondary, and then your tertiary. A lot of the policies that we have, even like what we're talking about, is started at the federal level. But for a lot of people, their first entry into care is at at the national level, but people's first entry to care for a lot of them is at the primary healthcare level, right, in your communities. And then for maybe a lot of the work that we do at the hub, we focus on areas that have been affected by conflict. Some of these places, their primary healthcare center burned to the ground. So even if they wanted to get any kind of healthcare in general, they don't have a location where they can go to. So I think, and we're also such a huge country. A big part of it is also who's going to pay for it. So it's easy. We can sit down and, have all of the knowledge of, oh, this is what it's supposed to look like when we're implementing. This is what we're supposed to do. We're supposed to put these people here and have, but then if there's no budget line specifically for mental health care in the healthcare budgets, maybe even of the country, of the state, of the local government, then you see that all of that breaks down. And I think another challenge is who to hold responsible for what. Because there's a lot of collaboration, it also leads to a lot of everybody kind of waiting to see who's going to do what first and then who's going to assign. So that coordination of pulling everyone together, which is one of my favorite parts of being part of Nigerian mental health, is that we're all organizations that are kind of working in silos. And I think there needs to be more of coordination in a central way of like saying, hey, yeah, I know you're all doing your amazing work, but let's come together and learn from each other. Sorry, I have some notes. I'm going to be looking down a little. I think the human resource gap is also a very big problem that comes into execution, because even if we say we want everyone, once they go to, let's say, a general healthcare appointment, to have to receive maybe a mental health assessment, who is trained to give those assessments? And I'll talk about that in my next question, where I think culturally we need a bigger appreciation for mental health professionals. When we talk to students, we hear a lot of them say that, oh, I'm just studying psychology because that's what they gave me. There's no really like enthusiasm or pride in being a mental health professional. It's like, I didn't have the grades for medicine, so let me just, and it's a thing where even if I finish, I don't know what I'm even going to do with it itself. So even for them, even for the people who are studying the psychology, mental health, special education, we don't really have a way of building that talent and growing it and giving them internship opportunities and ways that they can be involved in mental health work, even if they're not necessarily licensed professionals yet. So, yeah, we have brain drain at the top, but even at the very bottom, when people are still really young in the system, we need to figure out a way of actualizing their talents and the passion that they do have. And then I think feedback loops as well. There's really no consequence for not doing what you're supposed to do. So even if you make a commitment, and I think this is also one of the really cool reasons why we're doing this tracker, so we can see in real time. But previously it's like, well, I said I was going to do it, I didn't do it, who is going to beat me? Nobody. So there's a lot of different things, but I don't want to hold us too long, so I think I'll just stop there.
Thank you so much, Benman, for stating that or talking about those very important things. I could really go on and on about, how you mentioned students asked to study mental health related courses. And there's the thing of what do I do afterwards? Or even things like, no, I don't want to take this one because people will start associating me with psychosis and the likes. Thank you for spotlighting those things. Kachi, it's so good to have you here. Definitely, we should be going to you now, but I'll give you a minute to catch your breath as you just joined us. So we would go to my own favorite. Again, please call me biased, but it's just for tonight. So, DJ, let's hear from you now. Over and again, we see how the music and entertainment industry does so many amazing and beautiful things. Most times, music and entertainment, they have shaped how Nigerians think about things like love, success, identity, and even social issues. So, from your point of view, how can the creative industry reshape how the public processes mental health without reducing real human struggles to mere content or temporary corporate campaigns?
Can you hear me?
Loud and clear.
Hello, everyone. Thank you very much for having me here amongst all these amazing professionals. First and foremost, coming from the creative industry side of things, I really do believe that the one thing that we have as creatives is storytelling. We have really amazing God-given gifts and things that you've learned along the way to use music, film, television, digital content. Now everything is content. But there's nothing, in terms of how you implement it and how you push it, and the seriousness of what people are supposed to take from it comes with the authenticity of how you create what you're creating, how authentic your message is, how authentic the acts and the different things you've decided to put in, especially, just something very obvious. Right now the country is in between literally trying to bring children and different people back, and from harrowing experiences, and these mental health societies and professionals are highly needed currently right now. Necessarily a joke at it everywhere. Where do people come back to when they have experiences that they can't even have with people that they've met, because there's nobody else there that would really understand them? And so the idea for me, the creative industry comes with authenticity in storytelling. That's really the most powerful tool that we have. And how we decide to project that, comes with, outside of not just budget. Now we have all these different apps that you can put things out there that are not just only telling you, please be aware that this is there, is also calling you to action in, it's not just about creating, it's about the partnerships that we'll make with organizations like yourself. That's how whatever we create becomes real. It's not just creating the content. Is okay, I've done this now. Please, how can you, as a professional in this field, help amplify this, and how can we reach out to anyone and everyone that needs this? It's not just, okay, we're just going to. So the idea is, how do we partner up? How do you collaborate? How do we constantly, learn? I'm also a student of, so everyone, I really admire what you do. I'm also a student of psychology, and where I went out of my way to also learn that and take a degree in that, because I feel everything starts from the mental. Even the music that we're dealing with, a lot of people will be singing songs that will lift you out of different situations, but the person is literally drowning in their own sorrows. Everybody can help, but can't really take care of themselves. So being able to collaborate and work with, organizations like Mental Health Nigeria, I think is extremely important, because we take what we're creating and turning it into the society. And that's the best way, I think, to use people in the creative industry, because at the end of the day, how do you use your gift to amplify what is needed by the people that actually love you too as well? So
Thank you so much for sharing that, Deja. Truly, the
yeah.
power of storytelling cannot be overemphasized, and not just storytelling, but doing it in the right and in a meaningful way. Thank you so much for sharing that with us. Kachi, would go over to you. Uh, you know,
Hello.
really. Hi, thank you for joining us.
Absolutely. I'm happy to be here.
Amazing. So let's get right into the conversation with you. We are very familiar with how media tends to shape the agenda of what actually happens in the country and what becomes the national headline, and what remains on the side as just, an every other day thing. I'd like to hear from your point of view. Has the Nigerian media done enough to investigate mental health as a core governance and budget issue, rather than covering it only as an occasional human interest story?
That's a great question. Good evening, everyone. I'm really happy to be here. Thank you for having me on this very, very important topic. I think that mental health is something that we need to be intentional about as a journalist. We have topics that we focus on, or let me call them bits. So when you get into journalism, you're either covering politics or business or health or some other field, aviation. Everyone has a bit sports, right? And oftentimes, mental health would come under one of these fields or in several of them. So, mental health, most of the time, is an afterthought. Even when we address the news of the day, we talk about we don't fundamentally understand that there is a reason people behave the way that they do. And mental health is something that, if we think about it, we can explain a lot of the challenges that we face in Nigeria through the lens of mental health. But I think there isn't a lot of awareness about it. There isn't a lot of acknowledgement of it as well. For lack of a better term, a lot of times when you bring in mental health into the conversation that has to do with, challenges that we're experiencing, it's almost seen as disrespectful, like you calling somebody mad or telling them that they're not okay, So one has to be very careful in almost diagnosing a person through the lens of what is right and wrong. Whereas sometimes people behave the way they do as a result of what is going on within them in their minds. And I think for me as a journalist, that has been a challenge. Even as a journalist, the mental health of the journalist as well. We live in a time where it is one of the most difficult things to do because you're overstimulated. You're reading the news every day. For me, I've been doing this for like 8 years, and having to go on air every morning to ask politicians the same questions about insecurity, for instance, is one of the most it's one of the most depressing things in the world. There was a period where I just couldn't do it anymore because I felt like I was losing my mind. I felt like I was crazy. Now, that in itself is something that if I didn't know how to step away and look after myself, it's going to reflect in my output. It's going to reflect in how I worked, how I did my reports. I speak for every other journalist when I say that we don't cater to these issues as much as we should because we don't know better. And like I started with, I think it's an intentional effort. I recently concluded a project for an energy company where they launched a safe space initiative, and they are partnering with schools to basically see how they can talk about safe spaces in high performance environments using their resource as a company as a CSR effort. That is an intentional move. Mental health is not going to fall from heaven and be known to everybody. I think there must be an intentional push by an organization to create a department or create a space where mental health can be discussed. Otherwise, people just will not be able to define it when that is the problem. So that's my response to that.
Thank you so much, Kachi, for sharing that perspective. And, thank you for also highlighting the importance of mental health of the journalists themselves. Truly something that we need to pay more attention to as a society altogether. So as we come towards the end of this segment, we'll just go around the room again one more time with, some questions for all of you panelists to still highlight not just the issues happening in society, but things concerning how more partnerships could happen about the tracker and even other promises that have been made not just from government, but from other key and major stakeholders, including us ourselves as a society. So Deja, we'll start with you again this time around on this segment. Most times celebrities and even cultural leaders, they are very quick to lend their voice to, awareness campaigns. And I'm not saying that is wrong. When something is happening, the issue, of course, so it won't be like, oh, I didn't say something, of course. They will just come out and say so that, when people are hitting or giving a backlash, especially on Twitter, exactly. So they come up quickly to say something. But I'd like to hear from you, or we would all love to hear from you. What does true accountability look like for celebrities and even cultural icons when the cameras are turned off? How can the creative industry leverage its immense social capital and even finances to access the structural policy changes and even fund some sustainable community mental health initiatives?
In all honesty, I believe it begins with advocacy when the cameras go off. You have to, outside of what you're and I think a lot of times people, how sometimes where you're kind of thinking the same thing that everybody else is thinking, but sometimes people just need that extra person to give that extra kick when you start it, and that's when you see everybody else speaking up. But it all comes from, I think, the same place of where the idea is we've been talking for quite a long time, and now we just need accountability. And the accountability can come up in any way where it's, I feel, when you're advocating for something, you should literally be able to learn from where it's coming from. So I'll give you an example. There's certain parts in the north that have been ravished, and certain schools have been out of. And there's this one lady who literally we have conversations with on a daily, and she's been teaching chess as well, alongside Mr. Tunde. And I see a way of teaching what you already have while talking and speaking in order to create communities. It's, when you're going back into the grassroots and you're collaborating with the people that are hit directly with the things that you're talking about, with a professional alongside. I say this a lot of times because you can't approach mental health issues as if you're just approaching something that you're creating content by. A lot of times people leave out the professionals, and this is why I always ask questions and I always take along people with me, because you can't just be asking, why are you in this situation? Why are you doing, there's different ways that you also have to learn in order to be able to be in situations like this. So I say I've certified myself with things like the Crisis Line Society, trying to understand how to speak. It's not because I went through all of these things, so how can you not get over this as quick as that? It's not about personalizing things for yourself. It's looking beyond yourself as an artist in order to see people as just mere humans going through a journey. So like I said, it's and we all have our own personal stories that maybe we don't always speak of, that can allow you to relate from a certain place of experience. They always say experience is the best teacher. And in all honesty, you can only talk in depth most times for things that you have experienced alongside professionals that tell you how best to deal with situations. So from cultural leaders, for me, accountability also means consistency. You can't just start and leave it. You have to consistently understand, why did I start this? What are the organizations that I can support that provide these mental health services? How can I myself partner up? Am I going to fund, by the grace of God, am I going to fund scholarships, helplines, emergency prevention, or, especially now where it's very obvious we don't have emergency services for a lot of things that are readily available to the general public. So these are the kind of things that I think you can take from, I guess, how you say online, from speaking, and then amplify them in real life. That's how I see the accountability of it. You can, do your best and push a little harder.
Thank you so much, Deja, for sharing that with us. Truly, hearing you speak, it just emphasizes the importance of lived experience and
It
truly.
does, especially as a mom now too.
Right.
So the
Right.
other things that you're fighting for and you're learning about and
What
you're
is she having
understanding
to?
more.
What did you put up? Is it number 29 or?
Oh, sorry about that. I think that's coming from elsewhere. I'm not sure, but please you can round off with what you were saying, Deja.
Oh no, I'm just basically saying, even as a mom, mentally, where my mind has changed in many different ways. So I look at things a lot differently as well, inclusive of how can I now use the platform that a lot of people have helped to build for something better, much greater than myself.
Amazing. Thank you for sharing that. And truly, hearing you speak just really emphasizes the importance of lived experience, and how, celebrities as a whole can't just use us to trend. Really, you should hear from us, learn about it. I'm truly inspired. I'm like, oh my God, this, what you've said about, you even going ahead to get certified in some of these important things. It's just like, yes, I should cut that clip and, put it out there so that other celebrities can actually learn from you in relation to that. Best believe that we'll be taking you up on that. And you mentioned how finances as well. Yeah, I'm gonna reach out to you, like support how.
We're all gonna reach out to one another, my sister. Thank you. No, but we definitely, I like the initiative, and I truly hope that we are, consider constantly we can check up on each other and also make each other accountable to what it is we've done here today as well. And by God's grace, together we can build something worth leaving behind.
Thank you so much. Thank you for
Thank you,
sharing.
everybody.
Yes, so we'll go to Dr. Tunde now. Dr. Tunde, something has been going around our lips on the news for so long, and now we would love to hear from you concerning that. Over and again, as of last year, the Federal Ministry of Health and the government as a whole, you publicly committed to decriminalizing attempted suicide by December 2025, and it's been 6 months past that timeline. In as much as civil society and the public actually understands how complex legislative and bureaucratic elements take time behind closed doors, the lack of the visibility of what's happening tends to create a massive information gap. So we know that you may be working, but we don't know what's actually happening, and we're like, the first month has passed, the second month, and then now it's been 6 months after. So how can the national program close the gulf between the official action happening behind closed doors and civil society awareness? And also, most importantly, what is the current verifiable status of the promise to decriminalize attempted suicide in Nigeria? You are muted, Dr. Joseph. We can't hear you.
Okay, yeah. So an update on decriminalization of attempted suicide in Nigeria. Anyway, so many things are going on, and there are things that are going on at the back end, but there have been a lot of activity also that at the front end. So it's not that everything has been hidden from the public. But again, let me also speak to some background. Well, I think it's always good to be ambitious, and I think we're quite ambitious when we set that 1 year target. Yes, and that again shows a commitment of government. Yeah, because if we put things in perspective, when we were taking these decisions and setting timeline for ourselves, it is because of lessons that we've learned, being aspirational and looking at things on ground. Well, Ghana has decriminalized attempted suicide to a great extent. It took them about 15 years to get to that level. Kenya has decriminalized attempted suicide through a pathway through the judicial system. It took them years to get to that level. And Nigeria, we are talking about that Nigeria has a National Mental Health Act today. We were talking from Lunacy Act and everything like that. But even in this current dispensation, to finally get that National Mental Health Act into place, it took about 13 years because it went through some process and it didn't see the light of the day. So we have gleaned from the experiences from those legislative engagements and pathway, how to do things and how not to do things. And so we make that decision with a tinge of aspiration and ambition that 1 year we want to decriminalize attempted suicide. We have made significant progress, and even the way that Nigeria has gone about it, when we go to global meetings, Nigeria has become like a role model. We set up a national task force for decriminalization of attempted suicide. What's it called? The National Suicide Prevention Strategic Framework was in 2023. That it was done in 2024. The government made a commitment that 1 year. And so we have passed the line by 5-6 months, but we have made a lot of progress. And as a country, as an executive arm, we brought all stakeholders to the front. The National Task Force for Decriminalization is very inclusive, as CSO, academia, religious organization, people with lived experience. And so, and of course, the Office of Attorney General was well carried along in this because this is an intersection between law and health. And what used to happen before, if executive or anyone wants to go through a legislative process, they go all the way without necessarily carrying the judicial arm along. But what we have done is an embedment. And of course, we have passed the 1 year mark that we've had for ourselves, but we've gotten the Honorable Coordinating Minister has reviewed that timeline, and we asked for another 1 year. But where are we today? The decision has been made after looking at all the options and everything. And of course, as Chime mentioned, that there is what's it called? That there is a bill already on the floor of the National Assembly for consideration. But the executive pathway that we are going as a government, and this is not just about government, but that we have come together, all stakeholders, we've looked at the pros and cons, develop a white paper, a government white paper. There's a government white paper that has been done and that shows what are the possible pathway, legislative pathway to get attempted suicide decriminalized. And the choice is to go through an executive bill. And when there is an executive bill, it shows a stronger commitment on the part of government. It says it's government that takes this as a primary responsibility. And so I can say that the FEC memo, a memo that is backed by the government white paper, is already sent to the Federal Executive Council for consideration. What does that mean? There is a pathway. It doesn't just go to the Federal Executive Council for consideration like that. It goes to the Secretary of the Government of the Federation, who is the Secretary, and they present it at the FEC memo for consideration. There is a queue there, and it is when it is considered at FEC memo, if it is, at the Federal Executive Council, that it goes, and then the presidency transmits it to what? The presidency transmits it to the National Assembly for consideration. And you know that there is the House of Rep and there is the there is the Senate. But the good thing, if you look at what is happening within the country, is that if the goodwill is there, if the political will is there, people say that that's a long way, but the truth is that if the goodwill is there, the political will is there, this will be a game changer for us. Look at what happened. You see the political landscape in the country presently. The presidency wanted a state police. And look at how it take together. Just yesterday, the Senate passed that. And then not only did they pass that, what did they do? They said it had been sent to the 36 states of the Federation. That shows that if government wants to drive something, it will drive it. And so if the Honorable Coordinating Minister of Health and the Honorable and the Minister of Justice of the Federation have harmonized position that this is the way to go, and they present it at FEC, then it means that we are almost done. And once it goes from there, it goes to National Assembly. But there's quite a lot of things to still be done. And that's why when I see some of the great work, the Nigerian mental health and other stakeholders are doing, I know that Chime was also very part of the process of the bill that is presently at the floor of the National Assembly. But the thing is, where we are now, we are at a tipping point. All the stakeholders need to aggregate all the effort together, have a front line. If that is already happening, let us harness our energy to get this thing done. Head or tail, nobody wins. It's the country that wins. We want attempted suicide to be decriminalized. And what I say to people is, seek first the decriminalization of attempted suicide. All other things shall be added unto us. And that's why I believe that this is our last mile. See, let me tell you, whether we will get attempted suicide decriminalized before or by September or December, it lies between all of us. And we have come up with a slogan, let's make this September a September to remember. September globally is dedicated for World Suicide Prevention Day. If this thing moves from fake, maybe within the next 1 month, can all of us be tailoring it and be following it at National Assembly so that by September, when we are doing World Suicide Prevention Day, Nigeria is on the list of people that have decriminalized attempted suicide. And if it does not happen, all of us know what happened for the Mental Health Act. And I want to correct that thing. Let us take history. The history is this. The National Mental Health Act had presidential assent on December 28, 2022, and it was gazetted on December 30, 2022. The news carried it in January 2023. That's why people are saying that it was presidential assent in 2023. This was in 2022. And what is the relevance of it? If government and stakeholder want to get something done, they will get it done. Can you imagine that presidential assent when almost everybody was on Christmas holiday, December 28th, and there are laws that they will pass before they gazette it, it may be 6 months, 1 year, but people were waiting to carry it to the press. And in 48 hours, it was already gazetted. And the thing is that where we are now, we have 2 points, September or December. You know that election is almost here. If we don't put all our hearts together to get this thing done before January, then it means that we may be waiting for another political dispensation. So it is a serious matter of urgency that all hands have to be on the deck. It takes a family to give birth to a child, but the whole village to train up the child, at least when we were growing up. And the same thing is about the issue of decriminalization of attempted suicide and by extension, every other thing. So this is what is happening. What are the other things? We are having webinar. There is one that is going to come up at 30th of June. I think we have put that everywhere, which is talking about lived experience. And there are so many other things. People that are on the platform, all this information have been disseminated from time to time. I know there's more to be done, but we are just focused on results and we try as much as possible to carry as many people along. Thank you so much.
Thank you so much for sharing that, Dr. Tunde. Definitely, I've heard and picked up a lot, and we're hoping that by September, as you stated, we are hoping and truly hoping that by September,
Let's not just hope. Let's get to work together.
Okay, of
Let's
course.
make it a September to remember.
Definitely, we're here to support us. So we'll take you for your word, really. We'll take you for your word. So, Ben Moon, we're going to have you up next shortly. We will be rounding up this conversation in another 10 minutes as a whole. But I just want to state to all panelists that shortly after Ben Moon answers her next question, we'll be taking a picture. Also, just so you know, ensure that we have this captured, and then would call it almost an evening after taking a or two questions, basically. So Ben Moon, over to you, and also kindly appreciate that the panelists, I know that we have a lot to say. I could keep us here for hours, believe you me, but let's try to speed up with our responses so that we're not keeping people here too long. So Ben Moon, let's go to you. I would ask you if every regular citizen, whether they work in government or they work in a private sector or whatever thing that they do, if every regular person, when you strip off the titles that we hold and carry, could track just 3 baseline indicators to determine whether government is truly serious about mental health in their individual state and at the national level, what would those metrics be and why?
Okay, I definitely think as everyday regular citizens, there's so much we can do to be involved. And someone in the chat said we should make a distinction between general like mental health, well-being, emotional regulation versus psychiatric, care. And when we start to make that distinction, I think everyday people can begin to see themselves as key players. And something simple is, let's say you're in your women's fellowship group in your church. How many meeting sessions have you had where someone comes in and talks about mental health? How many meetings have you had where someone comes in to talk about postpartum depression? If you work in a corporate setting and you have health insurance, does your health insurance carrier provide therapy as part of the things that are inside of your, what do you call it, your health insurance? And how can you advocate for that in your office? When you're having conversations with your friends and people are saying, oh, this person is mad, or let's say you have a relative that goes to rehab, but you tell everyone that they traveled for a meeting for 3 months. There's so much I think stigma and shame in the way that we talk about and the way that we see mental health and just well-being in general, that if we start asking questions, because we of course work at the national level, but a lot of change can only be seen if, as individual people, you manufacture consent within communities and kind of bring the energy of the people to say we require this to happen. Because if, let's say, a full community goes to their local government chairman and says we need somebody who can do mental health care assessments in this primary healthcare center, that's movement that you're going to see because the will of the people is behind it. And so in terms of, we could always say, yeah, people should track budgets and the number of mental health care providers in their community. But ultimately, I think the most important for regular everyday people is the way that we talk about well-being, and also what we can do in our own small areas to make sure that these conversations are happening. Thank you.
Thank you so much, Ben Moon, for that. I think we're about to take pictures. Mrs. Vivian, please, if you can join as well, turn on your camera. Also, Deja, I realize also that she's having some connection issues, but definitely we want her in this picture as well. Chime, please turn on your camera. Ade, let's have the team and we'll take a picture real quick. Yes. Let's do that. Great. Kachi, kindly turn on your camera as well. Okay, I'm just trying to check in with Deja. The network is kicking her out, but she will be here shortly. So we can take this picture. Kachi, are you here? Okay, I would need our widest smiles. Mrs. Vivian, please, if you could turn on your camera as well so we can take a picture, that would be lovely. Let me spotlight. Okay, Jimmy, I need to spotlight you. Great, you are here. Who else? Okay, let's just give it a minute really for Deja to join in, but we could take one picture now while we're waiting for her to sort out the issues. Okay, so I will stop talking for a little bit while I ask us to, so just smile. I'm about to take a picture. Please smile, and I will take it right about now. Our participants, please feel free to turn on your camera as well, okay? So we can take a picture. I'm taking another one right about now. Please smile, give me a widest smile. Hold on, I'm about to get it in. Okay, great. I was told that she's still having some network issues, so hopefully when that is sorted, but as I said, we're rounding off this conversation shortly. So thank you, Ben Moon, for that. Truly appreciate it. Let's just quickly go to Joshua and Kachi, and then we'll call it an evening. So Kachi, from you. Now, we've launched this tracker. It's a beautiful resource. Everyone has seen it. We're all saying this is amazing. and all of that. But would like to hear from you. How can journalists use this new specific policy commitment tracker to ensure that we move from reactionary reporting to long-term investigative journalism? What is the strategy for keeping this metric alive in the news cycle where there is an intentional way of talking about it beyond World Health Day or World Mental Health Day and trying to make specific news headlines to just trend for some reason?
All right, thank you. So I think the key thing is mental health needs to move away from being a day that we celebrate or a month that we mark and do a report on to a lifestyle. It needs to be something that we report with an awareness of. I think that every single story that is told needs to have a mental health check where we're able to look at a situation through the lens of mental health. The same way we look at a situation through the lens of good, bad, right, wrong, um, fact, myth, you know, those lens, truth and all of that. I think it's important that we start to look at mental health, like look at stories through the lens of mental health as well. I think it's important that we have more mental health practitioners understand that what they do is so pivotal right now, and it needs to be it needs to go beyond just being a job. It needs to be a lifestyle. It needs to be a lifestyle where if I meet you and you, because it's a training as well. I might not have the required skill to detect or to manage or to help, but it's something that I will be more than willing to learn. If there's, like, how doctors would always tell you how if there's something wrong with you, quick first aid check and stuff like that. I feel like mental health needs to start being talked about in that light. If someone is going through something, what is the first three things that you do before anything else? So I think that's how we can really get involved in it. No longer look at it as something we do once in a while, but we need to make it something that we are aware of in our everyday life.
Thank you so much, Kashi, for stating that. It reminds me of what the keynote stated earlier, how that's Mrs. Vivian, how, mental health is any of us and all of us at the same time. Thank you for sharing that, and definitely beyond this conversation. See how I'm holding everybody to one thing or the other. I'm also holding you to ensuring that, we're able to keep this alive in the news. As we know, you are one of the top people in this space in the country. And so we'll round up this panel session with Joshua now. Joshua, we've learned over time the importance of domestication, but we also know that domestication of the Mental Health Act is only the first step, and real accountability relies on transparent, verifiable data. And so for independent tools like the policy commitment tracker we're here to launch today, government agencies cannot keep their metrics behind closed doors. So I'd like to ask you specifically, how is Lagos Mind planning to institutionalize data transparency so that your operational milestones, for example, like the helpline data, like primary healthcare integrations that you had mentioned earlier, and also things around, service delivery and the numbers which you've been able to conquer over this past years. How is Lagos Mind planning to ensure that, all of these things are openly accessible for civil society to also independently verify the things that you've said you have done at Lagos Mind?
Okay, thank you for that question. This is one question I welcome because it holds us to the same standards that we are asking for others. But I want to say this, health system is not a default, and there's a documented challenge with data interoperability in Nigeria. So the access to data, it's a huge issue. But yeah, what can Lagos Mind or what's Lagos Mind currently doing? So currently, internally, we have HMIS units where we submit data monthly, helpline calls, interactions, the rest of them. I think what would happen is for us to see if we can extend that externally. like this platform we have here. But in practical terms, I think there are just three practical things I can say for now. We need to have, because Lagos Mind is not the only tele-behavioral helpline that exists in Nigeria. And if we want to make it a policy that covers all telecounseling, for instance, that exists in Nigeria, the practical steps we could take is to standardize our operating framework. I've seen the dashboard, but I think what we can add is what are the frameworks, what are exact metrics we should be looking to add to that to monitor? What are we measuring in our PCs, right? What are we measuring in our helplines? Is it locations? Is it disaggregation of the mental illnesses issues and the rest of them? The second thing is to define a reporting cycle. So do you want to do it monthly, quarterly, or yearly? So I think it's something to also consider. And then the third thing is that, like you said, this is an open dialogue. We're having this conversation exactly. And I think, and I'm actually very, very, very sure that Lagos Mind and Lagos Ministry of Health will be willing to extend the existing data within our framework for tracking and for evaluation. And I think using this infrastructure that currently exists now would help for accountability. So honest truth is that we are not there yet. So, but we are committed to building directions to real institution and real partnership with Nigerian mental health for the distribution of the data to track the impacts that we made so far. Thank you.
Thank you so much, Joshua, for that. I think so far our panel has been amazing. Can we get a round of applause for every panelist? Thank you, Joshua. Thank you, Dr. Tunde. Thank you, Kachi. Thank you, Deja. Thank you, Ben Moon. It's been an amazing one, listening to us. And truly, I could go on and, probe us further, really, just pick on us based off the amazing things that we've said. But time is fast spent, so we would not be doing that. However, again, we truly appreciate you for sharing your insights in relation to pressing issues from your different fields around mental health in the country and what can be done to improve on the space and the landscape altogether. Thank you so much for that. So shortly now, we would be going into the closing remarks. I know we want to take so many questions, but you would have to stay updated with us. Send us an email at nigerianmentalhealth@gmail.com. You can send us a DM on Instagram, on Twitter, any social media platform you can think of. We are there in relation to this, and we'll be sure to find a way to ensure that the panelists or the keynote, whoever you have addressed your question to, responds to you, and we get you the response that you need. But Chimia Soni, it's time for us to have you again to give us a closing remark. It's been an amazing conversation so far. Would like you to tie it up for us, and then we would call it an evening.
Can you hear me? Am I spotlighted?
Let's see. Where are you? Okay.
I don't know if you can see me. Can you guys see me? I think we can take off the slide and let me just talk.
Okay.
Okay. Yeah, just remove the slide. Thanks, guys. This has been an amazing conversation, and I learned so much today that I'm very, very impressed. I want to share a couple of thoughts. The first one is that we need to be able to scale things that are working. Kachi, who's one of the hosts at Arise, mentioned that she was working with a company that was trying to scale their product to use safe spaces. That's an initiative we are not aware of, and Kachi would like to reach out to you to see, can we understand how that works, especially in the media space, and see how we can scale. We heard from Deja that it's a question of authenticity, but it's also a question of partnerships with organizations like Nigerian Mental Health. I didn't know Deja actually studied psychology. I learned that today, and we would like to partner with you going forward in the future. We heard from Vivian from Nigerian Health Watch that they've been engaged in a number of campaigns, the U equals campaign focused on HIV. Also, one focus on maternal health. And as an accountability and watch dog, it would be important to discuss with you and to amplify. We've been in conversations today concerning the Ministry of Health in Lagos, and we heard Joshua discussed the metrics and that it was a closed internal system, but that potentially we could work and collaborate with the best practices that they have to make that an external system that we can broadcast and potentially use as a best practice for others. So the question of the key stakeholders is very, very important. The second question is about partnerships and amplifying those things. Another bit of information that I did not know today is that Dr. Ojo mentioned in the chat that 28 of the 36 jurisdictions in Nigeria have a mental health desk. Now, if NMH knew that information and we partnered, we identified the 28 states, the remaining states that didn't, we could do a pressure campaign. We could work with our partners in the states to see how we can work at the subnational level. That's how partnerships work. And that's how, where there can be an interchange of ideas and we can actually collaborate. And we're not people who talk about the issues. We try to make these things happen. And so I'm excited by a lot of the lessons learned I've learned here. I want to be honest with people here who are maybe new to advocacy or stakeholders. We were very tempted not to ask the question to Dr. Ojo about the commitment made concerning decriminalized attempted suicide. Our thought was we want them to show up at the conversation. Let's not ask him. And we can see that not only did we get benefit and insight from the conversation, but we got more understanding of where things were and what he would like us to fall in line to. We learned about the FEC memo. We learned that and now it's not a December commitment, that it's a September, December. For the sake of argument, we're going to say it's extended for a year. So that's something we can hold them aligned to. We learned that there's a lot of movement on that track. And so the question for government continues to be, how do you carry us along? How do you have insights here? And let us not be shy about asking questions that pertain to people committing suicide and living their lives. Nigeria has the highest as a raw number of depressions. We have high rates of suicide. We need to ask the questions because their lives at stake. And so some things we need to remember is we're happy to push anything that supports decriminalized attempted suicide, but it has to be a two-way street when we're talking to government. We can't keep on sending letters and not getting a response. We're glad we're here today, but we need to have that engagement. And we're happy to amplify those messages in the media and TA to help push and get stakeholders aligned and coordinated, as Bermoon said, the over 50 plus organizations that we can work with today. A simple example of this has to do with our rehabilitation and mental health centers. Government, at the last conversation we're at, said that we can work with you to amplify that stakeholder of centers and information. We haven't gotten an update on that. So we need to turn this from words to actions. We need to have that reciprocal exchange of information, and we need the media, entertainment, civil society to ask the hard questions so we can get the answers that we need. I'm very excited by the conversation that we had today. I'm very excited about what this could mean, and I'm very excited to collaborate as an organization to see how we can push this and continue to amplify the amazing reforms that government and others and the best practices that are happening at the subnational. But this, as you see, would not be possible by some other organizations that help collaborate with us. We have the Nigerian mental health ecosystem, but I want to elevate some of our partners that really did a yeoman's job of amplifying this work, providing comments on our data tracker. We have organizations like Mind Over Matter Nigeria. Can we give them a clap? Can we give organizations like Nigeria's Mind Over Matter a clap? We have organizations like Stilt Nigeria. Let's give them a clap for partnering and collaborating to make this possible. We have organizations like Mental Health Policy and Research Hub. Can we give them a clap as well for helping make this possible? Can we get Mental Health Transformation, MHT, an applause for helping make this possible? Can we give Our Better Life a clap for making this possible? And then our final partner within our network that really made this possible was Evolve Foundation. Can we all give them a clap? In the coming days, we will be pushing this in the media. We'll be pushing this with actors, both international and domestically. And we look forward to having a proud partner in the mental health sector in terms of government to demonstrate best practice and to demonstrate how do we scale this? How do we scale this work? And how do we make Nigeria another lion when it comes to behavioral health reforms? We're already doing it. Dr. Tunde Ojo said something great. The only reason we can hold them accountable is because something is there. And so our job as civil society is continue to amplify these efforts, continue to make sure that we're part of the conversation, but it needs to be collaborative. And we hope to collaborate and partner in the future. Well, hopefully this mental health policy tracker is an important part of that conversation, but all of us are an important part of our conversation. And you guys should stay in tune with the next things that we're going to have. We're going to have a lot of different programming, from digital health apps to a mental health scorecard and things like that are coming forward in the future. So make sure you watch this space. Follow us on social media. It's our links to Facebook, Twitter, we're everywhere. LinkedIn are going to be shared in the chat. We really appreciate for everybody for attending this conversation today. And make sure you remember that it's okay not to be okay. Ask friends and colleagues how they're doing, and making sure you check our crisis hotlines if you have any other issues in the future. Thank you so much. And I appreciate you guys. Make sure you follow us, and you can say bye in the chat, but really appreciate everybody for coming today.
Thank you so much, Jimmy, for that. Thank you to every single person that has attended this event. It was lovely having you here. I hope you see how important such a conversation is. I hope you're glad to also be part of this historic event. Thank you to our keynote speaker, Mrs. Vivian. Thank you to every panelist, Ben Moon, Dr. Ojo, Deja, Kachi, Joshua. Thank you to all our partners again, as Timmy has listed every single one of them. This event would not have been possible without you, especially our participants. And we're hoping that beyond now, you're able to keep up with it, stay engaged with us through our social media platforms, ask your questions in relation to this launch, as I've stated earlier. You can send us a DM or send us an email, and we look forward to working with every single one of us to improve the landscape for Nigerians in Nigeria and the diaspora. Until we see next time again. Bye, everyone.